In today's lecture, I am going to discuss about classification and mode of action of antianginal drugs. Antianginal drugs are used for the treatment of chronic angina. Drugs belonging to this category act by increasing coronary blood flow and oxygen supply, or by preventing vasospasm and clot formation and associated decrease in blood flow. Classification of antianginal includes three main categories according to mode of action of drugs. These categories are vasodilators, calcium channel blockers, and platelet aggregation inhibitors. These categories can be subdivided in several subcategories according to drugs' structural properties. Vasodilators include nitrates. Drugs in this category are amyl nitrite, nitroglycerin, pentrierythritol tetranitrate, and isosorbate dinitrite. Calcium channel blockers include phenylalkylamine verapamil, benzothiazepine, diltiazem hydrochloride, dihydropyridines, nifedipine, amlodipine, nicardipine, and nimodipine. Diaryl aminopropylamine ethers include pipridyl hydrochloride. Last main category is platelet aggregation inhibitor. It includes dipyritamole. First main category according to mode of action is vasodilators. Vasodilators are medications that dilate blood vessels. They affect the muscles in the walls of your arteries and veins, preventing the muscles from tightening and the walls from narrowing. As discussed earlier, this category includes isosorbate dinitrate, pentrierythritol tetranitrate, nitroglycerin, and amyl nitrite. Next main category according to mode of action is calcium channel blockers. Calcium channel blockers lower blood pressure and treat other conditions such as chest pain and an irregular heartbeat. Calcium channel blockers lower your blood pressure by preventing calcium from entering the cells of your heart and arteries. This category includes phenylalkylamine verapamil, diaryl aminopropylamine ether pipridyl hydrochloride, benzothiazepine, diltiazem hydrochloride, dihydropyridines, nifedipine, amlodipine, phalodipine, nicardipine, and nimodipine. Last main category according to mode of action is of platelet aggregation inhibitor. It includes dipyridamole. Dipyridamole is a nucleoside transport inhibitor and a PDE3 inhibitor medication that inhibits blood clot formation when given chronically and causes blood vessel dilation when given at higher doses over a short time. Next is mode of action of antianginals. In this, first of all, I will discuss mode of action of nitrates. The organic nitrate agents are prodrugs that are sources of nitric oxide. Organic nitrates rapidly denitrated in smooth muscle cell and they produces nitric oxide. Nitric oxide activates the soluble isoform of guanyl cyclase, thereby increasing intracellular levels of CGMP. In turn, CGMP promotes the dephosphorylation of the myosin light chain and the reduction of cytosolic calcium 2 positive, and leads to relaxation of smooth muscle cells in a broad range of tissues. Relaxant effect on vascular smooth muscles and the dilation of coronary vessels improves oxygen supply to the myocardium. The dilation of peripheral veins and in higher doses peripheral arteries reduces preload and afterload, thereby lowers myocardial oxygen consumption. In this picture you can see nitrodilators produces nitric oxide. This nitric oxide activates the soluble isoform of guanyl cyclase, which is guanosine triphosphate. This guanosine triphosphate increases the intracellular levels of CGMP, where CGMP is guanosine monophosphate. Increasing the concentration of cyclic guanosine monophosphate have two effects. These effects are dephosphorylation of myosin light chain kinase and reduction of cytosolic calcium 2 positive. This leads to relaxation of smooth muscle cell in a broad range of tissues. Next is mode of action of calcium channel blockers. Calcium channel blockers block voltage-gated L-type calcium channels in cardiac and smooth muscles. They reduces intracellular calcium concentration and muscle contractility. Types of calcium channels: L-type, T-type, and N-type. In case of L-type calcium channels, activation threshold is high, while inactivation rate is slow. None of these channel blockers interfere with calcium-dependent neurotransmitter or hormone release because these processes use different type of calcium channels that are not blocked by these agents. Here you can see a calcium channel in activated state. Activated channel permits the entry of Ca2 positive ions, which results in increase in intracellular concentration of calcium ions. After entering the cell, calcium 2 positive activates specific calcium receptor proteins, example calmodulin. Calmodulin is represented by CAM. Calmodulin is a multifunctional intermediate calcium binding messenger protein which activates myosin light chain kinase when it is bound by calcium, thus making smooth muscle contraction possible. In the healthy heart, voltage activated calcium channels are essential for the generation of normal cardiac rhythm, for the propagation of excitation through the atrioventricular node, and for contraction in atrial and ventricular myocytes. In diseased myocardium, calcium channels can contribute to abnormal impulse generation. Calcium channel blockers reduces the frequency of opening of calcium channels in response to depolarization, which results in decrease in transmembrane calcium current, decrease in contractility throughout the heart, and decrease in sinus node pacemaker rate and atrioventricular node conduction velocity. Last one is mode of action of dipyridamole. Dipyridamole is a nucleoside transport inhibitor and a PDE3 inhibitor medication that inhibits blood clot formation when given chronically and causes blood vessel dilation when given at higher doses over a short time. PDE3 is a phosphodiesterase which is clinically significant because of its role in regulating heart muscle, vascular smooth muscle, and platelet aggregation. Thank you.